Tuesday on Kababayan LA. Dr. Banyas here answering your questions. At sana po marami kayong natutunan. Sana you were taking down notes because, you know, even if you weren't able to field in your call or we weren't able to field in your call, at least minsan nagkakapareho yung mga situations, no, Doctor. Very common among Filipinos yung mga heart disease, diabetes, high blood sugar. Yeah. What about liver disease? Let's talk about that. How important, how scary, how serious are those?
Liver disease, the main thing right now is hepatitis B and C. It's a very serious problem. It's very common in Asians, especially Filipinos. It's we are seeing.
Why are we prone to that?
We have high prevalence of the disease in our country, and it's not being diagnosed properly. We are only seeing the tip of the iceberg in the Philippines because diagnosis of this condition is not really being done very well. Hepatitis C is more common than AIDS or HIV.
Wow.
And
but is it as serious? Is it a lifetime thing also?
The thing about hepatitis B and C, it affects your liver and it increases the risk of cancer of the liver and cirrhosis of the liver. And if you don't have it treated early enough, then it will cause some serious complications. These are acquired through use of IV drugs, blood transfusions, sexual activities, and it's very, very hard to prevent this without, proper education and proper treatment.
What about the symptoms? What are the symptoms that we need to look out for?
The symptoms are not very common. Usually flu-like symptoms when you first acquire the disease, but it should show in your liver. If your liver is affected, then your liver enzymes are usually higher than normal, and you have flu-like symptoms like fatigability, weakness, easily get tired, and the symptoms are not that bad, but the diagnosis is very important because treatment is very important.
Very important. And very early treatment is better, of course, as with anything. But let's say, for example, you've been exposed to that, or you think you may have been exposed. How soon after do you get yourself checked? Do you get yourself checked a week? Meron bang incubation period?
There is an incubation period. It usually takes 3 to 6 months for it to show when you are initially exposed from the virus. And the main thing, if you are really have a very, what you call, different lifestyle, like...
if you're using drugs...
Using drugs, then you have
if you're
to really...
sexually active
and unprotected
multiple partners,
sex, multiple partners, then you have to really be aware that the possibility of getting this disease is higher than the normal population.
Even if your partner doesn't show symptoms at the time of the intercourse,
yes. Usually when you have the disease and your liver is not totally affected yet, then you don't have any symptoms that much, It all depends on the viral load that you have, your liver enzymes going up. If you have a high quantity of the virus in your system, then you can spread this disease to anybody. So especially like sexual activity and IV drug use, as I mentioned.
Before we end today's show, Doctor, would like to remind everyone, for those of you who have additional questions, that's the number to call on the screen. Dr. Banyas, what I like about Dr. Banyas, very thorough siya, kapag nag-explain siya ng mga, at sumasagot siya ng mga tanong, he also speaks Tagalog. So for those of you na medyo nahihiya, magpaliwanag in English, he can talk to you in Tagalog. That's the number to call on the screen. Dr. B, in closing, what can you say in general about our health? How do we protect our health? How do we live healthy?
Mostly for Filipinos, we have to really change our diet. We have to learn more how to exercise.
All right, we'll end on that. Last 30 seconds on the show. Change your diet, learn how to exercise. We'll talk more to Dr. Banyas in the coming days here on the show. For now, thank you for joining us. I'll see you again tomorrow.